The head of the agency most directly involved in rolling out the troubled healthcare.gov website testified today on Capitol Hill. Her message, "We're sorry." But surprisingly, most of the questions put to Marilyn Tavenner weren't even about the site or its many problems. As NPR's Julie Rovner reports, lawmakers grilled her on a long-ago promise made by President Obama.
Tavenner, who leads the Centers for Medicare and Medicaid Services, began with an apology for the rocky rollout of the Federal Health Exchange, something the computer contractors who testified before a different House committee last week neglected to offer.
We know that consumers are eager to purchase this coverage. And to the millions of Americans who have attempted to use healthcare.gov to shop and enroll in healthcare coverage, I want to apologize to you that the website has not worked as well as it should.
But most of the hearing before the House Ways and Means Committee was consumed with Republicans repeating a vow President Obama made often during the debate over the health law and ever since. Here's Illinois' Peter Roskam quoting the president.
If you like your health care plan, you'll be able to keep your health care plan, period. No one will take it away, no matter what.
It's turning out that's not the case. It's not yet clear exactly how many, but likely millions of people who currently buy their own insurance are now getting letters saying their insurance plans are ending because they don't meet the requirements of the new law. Many members of the committee, including Roskam, read letters from constituents who say they'll have to pay more for new coverage.
Can you understand the level of frustration and concern about what many Americans perceive to be a false claim from the administration?
Tavenner, however, says it's not that simple, and it's not all bad. Many people who say they like their current plans don't realize how little they cover.
Sometimes they were in plans that they thought were fine until they actually needed a hospitalization. Then they found out it didn't cover hospitalization or it didn't cover cancer.
Now, she told the committee, health plans will have to meet the new minimum requirements of the health law.
You can't be denied. You won't be kicked off of a policy because you develop a problem. You may be eligible for tax credits depending on your income. So these are important protections that are now available through the Affordable Care Act, and I think that's important.
And at the White House, spokesman Jay Carney pointed out that some people might do better financially by changing plans.
You're actually going to pay less come January for better coverage than what you're paying now.
How many will pay less isn't clear. Back at the hearing, Republicans also pressed Tavenner on when the administration will release figures on how many people have managed to successfully enroll in health plans so far. To each, she gave the same answer.
That number will not be available till mid-November. We have over 700,000 who have completed applications.
How many people sign up will be a key measure of the success or failure of the entire enterprise. Altogether, the administration is counting on 7 million people to enroll between now and the end of March. But it's not just how many that will determine the viability of the insurance plans, but who, as Committee Chairman Dave Camp pointed out.
And I think critically important, of that 7 million, 2.3 million of those need to be young and healthy.
That's so there are enough healthy people in the insurance market to balance out those with pre-existing health conditions who, for the first time, insurers will be required to cover. Tavenner said she wasn't concerned about a slow start, even with the computer problems.
The Massachusetts experience was very slow initially, and then it started to ramp up over time. We expect the same type of projections.
Massachusetts implemented the same sort of requirement for most people to have insurance or pay a fine back in 2006. Tavenner repeated the administration's promise to have the website's problems cured by the end of November. Tomorrow, it's Health and Human Services Secretary Kathleen Sebelius' turn to testify before Congress.